So I want to end the show this week talking about the coronavirus. There have been a lot of improvements, a lot of advancements. Lots of people have gotten vaccinated. As I'm recording this on Wednesday morning, there is news swirling about a return to mask mandates. The CDC has put out new guidance yet again. There's a discussion at the highest levels of government of imposing mandatory vaccines if people want to work and they're in the federal workforce. And there's a boiling over frustration at the people who are refusing to get vaccinations. And in the midst of all this debate and all this turmoil, there was a story I saw last week, and you may have seen it too, that basically stopped me in my tracks. It's by Dennis Pillion, and it was in Alabama.com. And it's just an honest and heart-wrenching account from someone who was a doctor on the front lines of the battle against COVID. But it's also the account of a kind human being, someone who is extraordinarily empathetic. And if you haven't heard the story and you haven't heard her words, I thought I would share them with you. The doctor is Brittany Cobia, who was on staff at the Grandview Medical Center in Birmingham, Alabama, a place where there's a lot of increase in the coronavirus. And she had this to say in an emotional Facebook post and also in an interview with the media outlet. She says, quote, "I'm admitting young, healthy people to the hospital with very serious COVID infections." And then she says this, "One of the last things they do before they're intubated is beg me for the vaccine. I hold their hand and I tell them I'm sorry, but it's too late." Dr. Cobia compares this experience to the earlier days. She says, quote, "Back in 2020 and early 2021, when the vaccine wasn't available, it was just tragedy after tragedy after tragedy. You know, so many people that did all the right things and yet still came in and were critically ill and died." End quote. Of course, now there's a way to save yourself. There is a vaccine that's safe and effective. And so now Dr. Cobia has a ritual. She said this on Facebook, quote, "A few days later, when I call time of death, I hug their family members and I tell them the best way to honor their loved one is to get vaccinated and encourage everyone they know to do the same." And Dr. Cobia describes the anguish of the families, the confusion and the hurt, and sometimes the epiphanies. About the families, she says, quote, "They cry and they tell me they didn't know. They thought it was a hoax. They thought it was political. They thought because they had a certain blood type or a certain skin color, they wouldn't get as sick. They thought it was just the flu, but they were wrong. And they wish they could go back, but they can't. So they thank me and they go get the vaccine. And I go back to my office, write their death note, and say a small prayer that this loss will save more lives." End quote. There are lots of people who are angry, who feel no sympathy, no empathy for those who refuse the vaccine. But that's not how Dr. Cobia sees it. Quote, "You kind of go into it thinking, okay, I'm not going to feel bad for this person because they make their own choice. But then you actually see them. You see them face to face, and it really changes your whole perspective because they're still just a person that thinks they made the best decision that they could with the information that they have and all the misinformation that's out there. And now all you really see is their fear and their regret. And even though I may walk into the room thinking, okay, this is your fault, you did this to yourself, when I leave the room, I just see a person that's really suffering and that is so regretful for the choice that they made." Dr. Cobia explains the pragmatism of her approach. Her goal is not to accuse or alienate. She's a doctor. Her goal is to get more shots in more arms. And she says this, quote, "I try to be very non-judgmental when I'm getting a new COVID patient that's unvaccinated, but I really just started asking them, why haven't you gotten the vaccine? And I'll just ask it point blank, in the least judgmental way possible. And most of them, they're very honest. They give me answers. I talked to this person. I saw this thing on Facebook. I got this email. I saw this on the news. You know, these are all the reasons that I didn't get vaccinated." And then Dr. Cobia goes on and says, "And the one question that I always ask them is, did you make an appointment with your primary care doctor and ask them for their opinion on whether or not you should receive the vaccine? And so far, nobody has answered yes to that question." I know it's difficult for a lot of folks who've gotten vaccinated, and those who are not vaccinated are making it difficult for everyone else. You'll remember earlier in the show, I talked with Pete Buttigieg about the ways to persuade people to get the vaccine. And I think some of the heartbreaking lessons taught by Dr. Cobia would be good for us to remember. Be well and be safe.